Good noon to everybody. Welcome to online video lecture class of Biochemistry. Here I am presenter Dr. Subir Kumar Mandal, Assistant Professor Biochemistry Department at the Akij Medical College and Hospital, Khulna, Bangladesh. Previously I discussed about the protein metabolism. This was the first part, and today I will discuss the second part of this topic. Now, from the beginning, I will start from the amino acid pool. This is the important topic. So, what is amino acid pool? It is the free amino acid content distributed throughout the extracellular fluid. It is the available amino acid which is distributed all over the extracellular fluid of our body. An adult has about 100 gram of free amino acids which represent the amino acid pool of the body. Now, what are the sources of amino acid pool? There are different sources of amino acid pool, but of them, these are most important. Dietary protein, endogenous amino acid synthesis, now endogenous protein breakdown. These are the important source of amino acid pool in human body. In this topic or in this chapter, amino acid or protein metabolism, there are several clinical problems or clinical scenarios that every student should know. So let's begin. What are the clinical problems we have to know? At first, ammonia intoxication. Ammonia intoxication is the most common disorder in clinical study or medicine department. In ammonia intoxication, toxicity resulting from hyperammonemia. When ammonia production is over the normal level, then it will happen. Normal plasma ammonium level, we know 15 to 45 microgram per deciliter. This is the normal level. And what are the causes of this disorder? Principally liver cirrhosis. Liver is the principal organ that is responsible for urea cycle. So, if there is any disorder or any deformity, any enzyme deficiency or any types of disease, so ammonia intoxication will arise. Now, hepatic failure, deficiency of urea cycle enzymes. We know already what are the enzymes of urea cycle. Even a marginal elevation in the blood ammonia concentration is harmful to the brain, because we know ammonia is most toxic product in our body that must be excreted from our body. Ammonia, when it accumulates in the body, results in slurring of speech, blurring of vision, and causes tremors. These are the important signs of ammonia intoxication: slurring of speech, blurring of vision, and repeatedly tremors. It may lead to coma and finally death if not untreated. Now, second clinical problem, which is called uremia. So, what is uremia? Increased blood urea levels due to renal failure is called uremia. When renal failure is occurred, then uremia will be developed. Normal blood urea level is 15 to 40 milligram per deciliter. Now, here is another scenario also, which is called azotemia. It is also a clinical condition. So, azotemia is a clinical condition with elevation in blood urea or other nitrogen metabolites, which may or may not be associated with renal diseases. This is the basic difference between uremia and azotemia. Uremia associated always renal deformity or renal disease, but in case of azotemia, there may or may not be present any types of renal deformity or renal disease. This is the basic difference. So, azotemia may or may not be associated with renal diseases. Here are some also that are also nice to know for all students. Several types of disorders. These are not common but not also rare in clinical study, such as phenylketonuria. Phenylketonuria is the clinical condition, disease condition, that is caused by deficiency of hepatic enzyme, which is called or which is known phenylalanine hydroxylase enzyme, and this enzyme deficiency causes phenylketonuria. Phenylketonuria primarily causes accumulation of phenylalanine in tissues and blood, results in its increased excretion in urine. That means we can easily detect by examining urine in case of phenylketonuria. So, what are the clinical features of phenylketonuria? Principally mental retardation, failure to walk or talk, failure of growth, sequentially seizures, tremors and hypopigmentation. This is the important sign also and also symptoms, because frequently patients always tell about these types of deformity or these types of problem, hypopigmentation. Another one problem which is not also rare but is common in clinical study, that is called albinism. Albinism is an inborn error or inborn metabolic disorder due to lack of synthesis of the pigment melanin, because you know melanin pigment is responsible for our body color. Increased melanin production, our skin color will be more darker. So, it is an autosomal recessive disorder, albinism. The most common causes of albinism is a defect in tyrosinase, the enzyme most responsible for the synthesis of melanin. This enzyme responsible for the synthesis of melanin, tyrosinase enzyme. That's all for today. Hope you have enjoyed this session, and again I have come with a new topic. Till then, stay happy, healthy. Thanks for patient sharing. Thank you.